There was some, I just saw yesterday and looking up, there's some work on these SPMs and hitting arginase 1, which would deplete our local arginine.
Yeah.
That was very exciting because that's our whole point of this arginine issue and big push to arginine in a trauma patient is give them some arginine, but now the problem is arginase 1 is upregulated, so we have a deficiency in sepsis. Is there an arginine deficiency in sepsis, which is the postulate? And because the myeloid-derived suppressor cells are rapidly chewing up the arginine.
Yeah.
And these actually downregulate arginase 1, allowing so.
Well, that's actually tissue dependent too, because we also know that these mediators change macrophage phenotype. We've found this in many different scenarios, both at wound repair sites, in fat, in adipose tissue, where they change the macrophage phenotype to improve the local inflammatory response. We're now starting to appreciate that the adipose, especially in obese patients, is very inflammatory. We're finding that this is also important in cancer, where it's actually improving the clearance of apoptotic cells and cellular debris that are known to propagate the inflammatory response. So it's a very targeted, and we're still at the scratching the surface of understanding the detailed mechanism of how this is actually happening. But it's clearly targeting multiple systems that are important in specific diseases.
In the animal models they presented at the New York Academy of Sciences 2 months ago, I guess now, it was unbelievable to see. You saw radiation, how it damages tissue around the actual tumor debris. This will help clean up that radiation effect and take out the cells that are left there as debris. After chemotherapy, you shrink the tumor down, you got a lot of dead necrotic cells. These macrophages, which have now changed class, help clean up that debris.